Good morning, everyone. This is MnCHOICES office hours for Friday, January 9th. We're going to go ahead and get started. My name's Teresa Vanderbent, and I am the facilitator of today's call. I'm with MnCHOICES Training for the Disability Services Division. The list you see on this slide is all of the people who are participating in today's call. So when you see them introduce themselves or you hear them introduce themselves, say their name, you can refer back to this slide so you can see where they are from and what subject matter expert they are. So as you all know, this session is being recorded. We use web audio for you to listen to the session, and we put you all on mute. The reason why we put you on mute is because we don't want any background noise. We will call on you when you ask a question. We'll try to do it in the order that you've raised your hands as best as possible. So we'll call on you and unmute you, and we're going to ask you to give us a bit of context about who you are by just stating your name and your organization and maybe where you work, because you've got an idea in your head about what your question is about, but we're starting cold. We, like anything else, we can't read each other's minds. And so if you can give us just a little bit of context, it helps us get ready to answer your question as best as possible. So if you raise your hand and ask questions, you will be on the recording, and the recordings go in the DSD training archive. So let's just talk through a few ground rules. Our goal here is to improve the call for everyone, right? So we're all parties to this call, and we really want to be about a support. We want to support an atmosphere of good intention and respect. DHS staff is participating in the call to make sure you have information you need for your agency. Agency mentors are attending the call because you want to use this time to ask questions and learn what you need to know for your agency. We're going to ask that to be respectful to other agencies, you only ask one question, and then if you have another, get back in the queue. If you have a specific case really fussy to a person, we're going to ask you to put it in on the MnCHOICES help desk form rather than office hours, because we're likely to say to you, please put that in on the help desk ticket, because it's going to be too specific and we really need to look at the situation before the subject matter experts would provide an answer. We also ask you if you already have a ticket in the help desk. Don't ask it during office hours. The reason being is the team is working on a response. They haven't forgotten about you. They are working on it. They regularly meet to work on their responses. And if there are policy related questions that maybe are normally answered by CBSM, they also don't belong on office hours, because this really is a technical assistance call to help you with using office hour or using MnCHOICES. And so we just want to make sure we stay within the scope of the call. So just a reminder, MnCHOICES Partner Link has a mentor page, and that mentor page has the office hours conference calls, how to register for them, if you have new staff that are mentors, as well as how to submit office hours questions ahead of time. We work to review them every 2 weeks before an office hours call, and then add content to calls when there is content that we think will make sense for the slide deck. MnCHOICES Partner Link also has an outage schedule page where you can look at what's coming up for the next outages for MnCHOICES application. And that page was recently updated to remove the old 2025 dates. So here's our agenda. We're going to do help desk updates. I'm going to talk a little bit about training and other key updates. Then we'll walk through system updates. I think I have just like 2 questions from people that, or information that we want to share. And then we're going to go to questions. So the PowerPoint, as you all know, is on the DSD training page. And so I'm guessing most of you or many of you have it up and available. And the last pointer for you is if you've got a question and it's specific to a slide, if you would please say, hey, slide 8, then either I can go back to it if you need me to. If that's something you need me to do, say more about the slide. It just makes it easier. So if you can keep track of that, that would be good as well. So I'm going to go ahead and get started and ask Kong as a help desk person to join us for updates.
Hey, Teresa, can you hear me?
I can.
All right, that's great. So, this is Kong, your help desk personnel here. Um, well, this month I don't have much to report, so it could mean it's a good thing, you know, mostly good thing, bad thing. I don't have something to report. But no, like they say, good news, no news is good news. We haven't had any major issues since November. Um, uh, as far as system performance, it's been going well. We checked with the vendor as well, and things have been going well as far as the application, as far as usability and performance wise. You should no longer be experiencing like those blue circles spinning and stuff like that. We've worked hard to put in place to make sure those are not happening and stuff like that. So those are going well. If you're, you're hearing things like that, report it to the help desk. Otherwise, usually those are happening if you have users like having it, they're out on the field and maybe they're not. They don't have the best connection and stuff like that. So you might want to check with them on their connection and make sure you know, if it's just like that at certain areas, and they get back to a better area like an office or something like that where they have better connection, it's working for them, then it's great. But so far, performance wise on the application is going very well. Um, other stuff to just think about is at the help desk, we are still getting a few things that users are trying to get in and they're getting the access denied. So access denied, and we've been able to work with them and found out that okay, their URL within the bookmark. So URL is not correct. So it's not clean, and we have those instructions on partner link as well to correct those. So we've been able to remedy those by just correcting their URL, and they've been able to get in. So just make sure that users that report issues getting in, and they have those access denied issues. Um, check with the bookmark. You can right click and check the bookmark. Make sure it's clean. It's got to have the MnCHOICES.org. That's it, and they can get in and it shouldn't be a problem. But send those issues to the help desk if you're concerned, if you have issues, and we'll help you get around them. But other than that, um, everything seems to be running fine. I mean, like we have the last couple of months with the holidays too, so I'm not sure the issues has just been down because of that. But so far so good. So. Uh, that's all I gotta say. Thank you very much.
Thanks, Kong, very much.
Kong, this is Merritt. We do have one question. Are we going to take those now regarding help desk updates?
If the question is about the help desk update, yep.
Okay. Angela, I'm going to go ahead and unmute you and you can let us know if that is a question you have is for the
Mhm.
help desk.
Yeah, it's a technical question. I just needed a quick refresher. I
Yep.
was asked recently, like, how to change somebody's name, and I couldn't remember is that something I send into
Is
you,
that
Kong?
is that a client's name?
Well, the issue is we
Oh,
have a senior and a junior, and in MnCHOICES, they both have the same name, and it's not
oh.
they don't have the senior or the junior attached to their name.
Okay.
So
Yeah,
we're
that's a client name, and let me just tell you guys that MnCHOICES gets the information about client's name from Swindex. So whatever is in Swindex, and Swindex is fed by multiple systems such as SSIS, MMIS, Maxis, and so we'll have to look into those systems, and then we'll see what's available, identify if it's um I don't know what the right word is. Like is is it correct or is it legit, right? Legitimate, right?
Yep.
If it's legitimate and if it's in one of those systems, we can push it over to MnCHOICES. If it's not legitimate and say you have a user saying, "Oh, Tom should be Tommy," and it's not in one of those systems, then we'll have to advise you to go back and get a legit, because we can't get a legitimate um, answer. But as long you can submit those questions into the help desk, and then we will look in our systems to see if that name is available. If it is, then we could push it to MnCHOICES. Yes.
Okay.
Hmm.
And then one other question, if there's no other people behind me or comments, um, I did send that new URL and the instructions to a couple of my members, and
Hmm.
they were telling me that that link didn't work. That was in the instructions.
Mm.
I have not had time to go check it out myself, but I'm just
Okay.
gonna let you know, so if you have time, maybe you can check that.
Yeah, yeah, definitely. Let me know. I can work with the users and then find out what is needed. It's probably very simple. We can update their bookmark URL, make sure
Mhm.
it's working. It could be another issue. We don't know, but usually these issues just stem from having the wrong URL inside of the bookmark. So. Just let me know at the help desk, and then I'm very happy to help the users and get you guys back and make sure there's no issues.
Okay.
So Merritt, I would like to not take any more questions. I see other people are starting to queue up. I know they might have similar questions about client information. I want to make sure we get through all of the slides and then come back to them. Otherwise, I get a little bit afraid that we're not going to get through all the content.
Okay, sounds good. Thanks, Teresa.
Okay. So sorry, folks, if you're standing in line, you're just going to have to wait there a little bit just because I need to make sure that we cover the content first. So for today's call, we're going to look at the release that happened on December the 11th so that you're aware. And where the content comes from office hours is both the release summary that went out to you in email on December the 12th from the CFD that is the December version. I from time to time will have screenshots to help assist your understanding. And then also so you know, these recordings and the PDFs are on the Disability Services Training Archive page for about 6 months. At least 6 months, but sometimes they're a bit longer till house cleaning is completed. So I'm going to walk through some partner link, train link, and help center resource changes. Then we're going to get into the release. So we'll go ahead and get started. Part of what we have been cleaning up for Partner Link is with the addition of the conversational interviewing modules to MnCAT Step 3, Part 4, it has meant that we've had to update instructions on a couple of places, and that's what this is about. So the MnCAT instructions for lead agencies that's out on Partner Link has been updated to reflect those changes. Basically, they're title changes so that they're updated with the changes that we made to training. So. And then step 1, course 3, we did make content changes to course 3. We've changed its name to assessment practice considerations. And as you can see, module 2, module 3, and module 1, module 2, and module 3 have had name changes, and the content has changed pretty significantly. And so you can go in and take them under MnCH 100A and take them for CLUs if you would like, and we'll talk more about that. We're going to add some of that information later, but that content has changed, just so you're aware. And we had that content all loaded in TrainLink as of December the 31st to ensure any new certified assessors starting January 1 had that information available to them. In addition, Step 3, Part 4 had the conversational interviewing modules loaded. They're now available for people to take. Part 4's course name changed to Applying Your Practice and Recertification. So they'll take the conversational interviewing 3 modules, take the learning lab, and their introduction to recertification before they take their test. In addition, the new mentor module that is mentors who facilitate assessor certification was updated to make sure that we aligned with all of that other work that we had just talked about. So I also added the using the clean URL in that slide deck because I wanted to make sure that mentors had it and was available to them, especially for new mentors, so they would have it as a problem solving tool. And then for slide 11, we made sure the hidden links so that you could get all your step 3 links to your staff were updated, and that document itself was updated. So that's been done as well. Other changes. So there were some core product changes both to the My Dashboard and to the person tile when you're in the person record, that so that profile and contacts were inside of person record instead of profile being separate and contacts being separate. And so because of that, that meant some screenshot changes. So when you see the reference in this slide to logging into MnCHOICES that we did some updates to screenshots, it was because of the My Dashboard changes. So we need to make sure the screenshots showed accurately. And then for access and navigation overview of the person record, the same thing. That profile icon and person dashboard had the icons separately on the left-hand navigation for the person record. And so we had to make sure that all of the information was updated that accurately showed that. So when your staff are trying to train, they're seeing what in training, what's actually in the training zone. So that's been updated. Then in access and navigation overview of a person record, context, health information, and attachments, we again updated those screenshots so that they matched functionality. Anytime that there's a new release, we work really hard to try to make sure the functionality that your users see is what they see in training. And so that update has occurred. And then the same is true then under access and navigation for assignment and transfers. We just made sure the screenshots were updated and that they reflected any changes that in core product that occurred in November. Workflow support plan getting started. The EW budget exception request was added to the form category support plan under the form drop-down menu. So we made sure again that that screenshot was updated to include it and added the practice guide for that form in that slide as well. So workflow support plan, so that workflow course for support plan, the My Supports module, we made sure that we clarified that you can search by NPI and that you can use advanced search to search for other parameters. And that's what this left-hand screen is showing as the actual slide. So you can search by NPI is what that slide now says. The Smart Guide for Consultation Service Providers. So the consultation service providers, when they work in MnCHOICES, they use the Smart Guide to learn how to navigate MnCHOICES. And so it required some updates because we gave them some permissions to be able to go look at a person record assignment list to see what staff are assigned to the person in case they needed to talk with them. And so they can click on that person, they can find that staff member, and they can then go and have a conversation with a staff member via email or phone number. So That's the changes that were made for their document that they use. For the practice guide MnCHOICES assessment version 9, you're going to see that the daily living section under movement added a note for transferring. I'm not going to read the note completely, but what it is basically designed to do is help you better understand how transferring is defined. Then the second one, informed choice under choice to pursue consumer directed option, again was updated so that you're aware of that. For the Smart Guide Support Plan, MCO MnCHOICES Assessment version 6, we again updated the search heading to make sure we were clear because the instructions were actually incorrect or they were causing confusion, I would say for sure for users. So we wanted to make sure, yes, you can use search to search the NPI to find the provider, or you can use advanced search and look up a specialty code to find the service that you're looking for to then find a provider. And then status allows you to pick a service that is active rather than accidentally picking a service that's inactive. So, and that's what this screenshot shows. So in an advanced search, you can choose by specialty code and you can pick the status active so that you make sure you find a service that is actually something that can be used. And then lastly, for Help Desk Center updates, the Practice Guide EW Budget Exception Request form has been loaded to MnCHOICES. It was made available on January the 1st, and this document provides guidance for completing that EW Budget Exception Request form in MnCHOICES. So it provides you the instructions that you need to be able to use that form successfully. So now my plan for the rest of the morning, and then there will be plenty of time for questions, is we're going to walk through the release items that weren't in the current functionality document, but were fixed, things that were fixed as part of the release and were showing up as defects in the CFD, and then any items that were updated in the CFD as well as any new items. We'll go through just a couple of pre-submitted questions, and then there'll be plenty of time for questions for you. So just so you know kind of the order that things will be occurring in. So release items that aren't in the CFD, the system required an update to implement rate and budget changes that were occurring as of January the 1st. So those were implemented. And so please note that the disability waiver changes will take effect in February 2026. And I'm not going to kind of read through this with you. Instead, I'm going to ask you to go to the link if you want more information. And I took a screenshot of that as well. But just so that you're aware that that has occurred. And then next, there's a new form in the MnCHOICES application that will allow lead agencies to request an elderly waiver nursing facility conversion budget or an EW hospital high needs budget. And that's that EW budget exception request form that you heard me talk about just a moment ago. So it's available in MnCHOICES as of January the 1st. You can begin using the form for EW NF conversion budget requests as of January the 1st, and the form will be available for EW hospital high needs budget exception rate requests once federal approval has occurred. And it's my understanding that that has been approved and that an e-list went out about it, because just like the next line says, we'll send you an e-list and let you know. It's also my understanding that there will be a webinar about it as well. And you can also always refer to the MnCHOICES Practice Guide EW Budget Exception Request form when you want to look at how do you fill that out and to get some good guidance. So the last one that wasn't in the CFD is when assigning staff to a person record. If the staff assignment future date was in the future and then that assignment got discarded because it was done by mistake or whatever else, it would make it so that you couldn't assign a new staff member. Well, that's been fixed. So now the system will ignore an effective start date that's been discarded. So it won't get in the way of you being able to assign a new staff member. We're going to talk a little bit about the items that were resolved. There was just one. So this is about support plan printout heading. So for support plans HRA, MCO MnCHOICES assessment, or MnCHOICES assessment is created before a care coordinator or case manager is assigned to a person. Then the organization phone number field that says I can call the following number if I'm unable to reach my case manager care coordinator might appear in the system, but it won't show up in the support plan printout. And so with the changes that were made as part of the release, in that instance, when the support plan is created before the care coordinator or case manager is assigned, it will now display their phone number, the organization's phone number information in the I can call the following phone number if I'm unable to reach my case manager care coordinator field on the signature sheet, and it will display in the support plan printout as well. So this item was updated in the CFD. I'm not going to read through all of the detail, but what I'm going to tell you is what has been changed. So what has been changed is the age went from younger than 18 years to younger than 48 months. So this piece right here. And in addition, the reference also includes catheter and bowel program. So no longer just ostomy. So that's what's been updated. And again, I won't read through this one. This is one that has already existed in the CFD. It's just been updated to, with new information that we've learned. And then this is the directions on how to go ahead and enter the values for the LTS screening document and other directions. So in our work, when we work through defects and other items like that, from time to time, we find that there are similar issues going on across other things that really need to be grouped together because the issue is all related to each other, and that's what's happened with this one. In the past, the CFD item that was listed as DHS ID 182184 was just one item. And what we did is we took all of these ones that are listed here and put that under that ID number in the CFD, because what we found is that, guess what? All these are related to the same issue. And so the reassessment and current support plan waiver span having issues, the assessment updates the support plan more than once in certain circumstances as part of that issue, that number that I mentioned above, as well as a revised support plan pulls wrong assessed needs into a plan, and the areas of need appear when they shouldn't. They're all related to each other, and so they'll all be worked on together, which is good news because when they're resolved, it'll resolve them all. So we just wanted you to know that that work was being done and that we've grouped them together because the solution will come together. So items that are new to the CFD, we have two. One is on the MnCHOICES assessment screening document. So the system populates legal representative present at an assessment field in the DD screening document with an inaccurate response. And it really occurs because of in two instances. So the system populates the field with no when a person is younger than 18 years old and their parent is a legal guardian. And it also happens when the person is 18 years old or older and can make their own decisions. So the system will populate the legal representative present at the assessment field in that DD screening document with yes, based on the information from the contributors field in the assessment details section in both cases. So that's what's kind of causing it. So the system should populate the DD screening document field with yes when a person is younger than 18 years old and their parent is a legal guardian. And it also should happen when the person is 18 years old or older and makes their own decisions. So the directions for that are to select guardian as a relationship type for the parent in the context form of the person record. And this will allow the system to correctly populate legal representative present at assessment field in the DD screening document, and to make a note in the parent relationship in the notes that they are. So in the contact information for that parent, you'll pick legal guardian, and then in the notes you'll write parent of person or child, or depending on the age of that person record. So that will at least give you some information to say, hey, this is who this person is. The second one is about support plan printout. So the unique Minnesota provider identifier, we talked about this at last office hours, UMPI, is showing it's printing in printouts, and it shouldn't. UMPIs are considered private non-public data under Minnesota government database practices. However, the NPIs are public data. And when we talked last week, where I heard people getting stuck is that they were thinking it was all of the provider IDs have to be redacted, but it's actually only for provider identifier numbers where it begins with A or M. And so to know that, so that you're aware of that. So that's what the directions are about. And again, we did go over it quite a bit at last office hours. So I'm going to go through a couple pre-submitted questions, and then we'll be ready to take questions. So if you want to get yourself in the queue, have at it. So I want to talk a little bit about data integrity, and you're going to hear us talk about data integrity probably for a few office hours slides, because guess what? You as agencies and DHS are starting to use DHS data for reporting. So guess what? If it's a source of truth, which we say it is for assessment and support plan, the data is only as good as it's entered into MnCHOICES. And today I'm going to give you another example of that, okay? And how you can help improve the data integrity. So for MnCHOICES and MMIS matches, let's talk about that one today. So if a staff gets an edit when they're trying to enter into MMIS, we need them to go back to MnCHOICES, update the assessment information, go to the assessment results and use get results, and then enter the corrected screening data into MMIS. So go back. So you got an error in MMIS, go back to MnCHOICES, make the correction, run the get results so that you have the correct data to enter into MMIS, then enter it into MMIS. And in a place where we're seeing it is an inaccurate and effective date. And the goal is, or the way it should work, not the goal, this is how it should work, is that MMIS and MnCHOICES must match. That's what it says at the top. So lastly, I want to introduce you to some new functionality that's coming that we are really excited about. And I'm at the same time talking, I'm going to try to log in so that it's available to you. So sorry if it feels a little clunky on my part, because we'll see if Teresa can talk and log in at the same time. So the announcement tile is going to be something now that MnCHOICES can have some control over and put messaging in. And so what's going to happen is you're going to start seeing that release outages, system maintenance, help center and training resource updates, and technical difficulties will all start showing up in the announcement tile for everyone. And what's lovely about that is for release outage in particular, it'll mean no longer will you as mentors be getting a 10-day, a 5-day, and a day before release outage message to send out to everyone. Instead, they'll be in the system. People can see it themselves. The users can see the information directly. And we think that will be amazingly useful. And then for system maintenance, just to remind people, hey, the system's going to be out. We just want you to be aware of it. And then for Help Center resources and training, hey, here's what's been updated. And then lastly, we'll note when we can, when people are able to log in, if there are any technical difficulties in what they are, as well as that they've been resolved, and the resolved will actually stay up for 2 days. So I'm going to show you that in just one moment. And so this is what an announcement will look like. So you'll see a list of them. You'll be able to click it and open up the announcement and read it in its entirety. And so for the February outage message will be posted in the announcement tile in prod, so you will see it. And we, like I said, we won't email you any longer with outage messages, because those messages will be built into the system. So ask your folks to pay attention to this announcement tile. Have them read it every day. So I'm going to demo it so that you can see it. So I have logged into our testing environment, and you can see that on the left-hand side is the announcement tile. And in order, it's got resolve technical assistance, upcoming outage, help center resource update, training resource update, and scheduled maintenance. And so I'm just going to open them so you can see how they work. So I'm going to first just right click on the resolve technical difficulty. And what it's going to do is it's going to provide you a description of the issue that's going on and the date and the time that it occurred. And then if it's resolved, it'll mark it resolved so that people are aware of it. And it'll provide anything that that we know about the issue will be in the body of the message. So I'm going to close it. Then the upcoming outage message, again, I clicked on it, right clicked on it. I'll open it up. It'll say when the application is going to be down, and user instructions like you're used to seeing in your mentor emails will instead be here, so people can read it and follow the instructions for the outage. And then for resource and training updates, it's just going to give them briefly, here's the things that have been updated. And so in this instance, it isn't telling them each individual thing that's been updated. Instead, it says the CFD's been updated. There's a smart guide and some practice guides that have been updated. And it'll just provide more information about those. Training similar. It'll just say, here's the training that's been updated and the date. And then scheduled maintenance for those things that happen regularly for both production, MnCHOICES, and our testing environment when they will occur so people are aware of them. And then please know that there'll be a schedule for how long these stay up and how long before they're taken down, resolved. Once a technical difficulty has been resolved, the rule will be 2 days. Then it'll display as resolved, and then that will be taken down. So the goal is to have documents here that are useful to you, that you're using regularly, that you're looking at regularly because they don't get stagnant and because they have information that your users will find useful. Heather, is there anything else you'd want to add?
Yeah,
Yeah,
just
go for
one
it.
thing that I'd like you to show them is that if you could go back to
Yep.
MnCHOICES. So in the technical difficulty announcement or the scheduled maintenance announcement, if you see a link there, a hyperlink, if you hover over it and if you click directly on the link, it will take this web browser page directly there. So if you probably don't want that to happen. So if you go back, if you hover over, yep, you don't want to do that because then you have to do all this to get back. So if you hover over it and then right click, there you will see a drop down menu. And if you click on the first one that says open link in new tab, there you go. Then you can get to the help desk contact form in a new tab. So anytime there's a hyperlink there for you, that is how you get there without messing up your MnCHOICES tab that you have open.
Thanks, Heather. And we also added that to the access and navigation my dashboard training, that we also tell them that instructions for the new people who are taking it to do exactly that, open a new tab. But thanks, I forgot about that. I needed to demo that too. So much appreciated.
Thanks, Teresa. You did great.
So I don't have anything else to discuss. We can go ahead and take questions, Merritt. That's what I had on my slides for today.
All right. Emily, I will go ahead and unmute you.
Good morning. This is Emily at Hammer. I have a question related to a waiver case management individual, and it's specific to the help desk discussion around client name and where it's supposed to pull from. So I hear that it's supposed to pull from Swindex and that Swindex connects with Maxis and SSIS. But we have a scenario where the SSIS name is correct, but when we open the state details in SSIS, the Maxis line is wrong. But when Hennepin County employees who have Maxis access directly look in Maxis, it's correct there. So somehow between Maxis to SSIS, it's wrong. And that wrong name is also what's listing in MnCHOICES. And it's been this way for like 6 to 9 months. So I'm not sure how we correct it since Maxis is correct.
Emily, I think, would you like to send that into the help desk so we can look at that individual record, and then we can look behind the scenes, and then we can follow up with you after we are able to investigate a little more?
Yep, I will happily do that.
Perfect.
Yeah, and if you'll mark it as technical, then it'll go to the help desk, because the help desk is really the person who figures out the mystery behind each of the systems.
Okay, other than what I already have from Maxis and SSIS, is there any other system I should be checking, or just send what I have as far as screenshots from those two systems?
I would say just send screenshots what you have and make sure that you're clear about which systems you've checked. I think that's
Perfect.
sufficient.
Okay, thank you.
You're welcome.
Great, thank you. All right, next I have Keith Peterson. Oh, let me unmute you.
Okay, thank you. Yep, I work over at Cass County. And Teresa, I just had a question on your slides there with the NPI numbers. I know right now the guidance is to, like, if a work in the process of actually sending out the support plans out to the agencies and also to the clients, we have to readapt those. Right now, have been conversation or a way to redact those within the MnCHOICES system? That's a question I know that we've had over at our agency.
So
Or is it just you have to or is it just you have to download it as a PDF file and then make the correction?
yeah, that is the workaround. There isn't a
Okay.
way to redact inside MnCHOICES for the printed document. So you have to download it and then determine the best way you can do it for your agency.
Okay. Has that ever been kind of a conversation maybe with developers, maybe like, hey, is there a way to have it so we can just make the change within there?
In most cases, when we ask you to redact, it's because of an error in MnCHOICES, or because in this instance, something's displaying that shouldn't, and it's going to come with a correction. And so we wouldn't want you to make a change physically in MnCHOICES, because if you could do that, then people could do it in error and actually impact data negatively. And so the redactions are occurring on the printed documents while we work through the defects is the best way to do that, and not accidentally inaccurately affect other data.
Okay. I'll pass
Okay.
that along back
Yep.
to our
You're
team
welcome.
here. So
And Smeeze, if you have anything else that you would like to add to that, you're welcome to do so.
All right, hearing nothing, I will unmute Heather Schmall.
Hi, Heather Schmall with Nicollet County. I just have a question about the new announcements tile. You had mentioned that some of the stuff's going to be staying for 2 days, and then others for different amounts of time. I'm just wondering, like, is there another place where that information lives for staff that are on vacation, or for like me, I work part-time, so there's 2 days where I'm just not in the office where I would miss that information?
So Heather, I'm going to give you a chance to get in, but for the technical difficulties that are resolved, if you're gone for 2 days and they've resolved them, you probably don't need to know them. And then in regards to when and how often is the other information changed and updated is something I'll let Heather answer.
Okay, so that's like technical difficulties that are just happening right now, not like.
Correct.
Okay, that makes more
Yep.
sense.
Yep,
Thank you.
you're welcome. Go ahead, Heather.
Yeah, the upcoming outages, the help center resources, and the training, the train link resources, those will remain up there for the entire month. And then the scheduled maintenance, that announcement will just stay up there all the time. So you know when those scheduled maintenance outages are occurring. So it's really just the technical difficulties. If there's an issue happening with the system, we'll post it there. And then once it's resolved, we'll add that resolved indicator for you, and it will remain there for 2 days.
Thanks, Heather.
All right, next up, Emily. Oh, just wait. Oh, oh my goodness.
Me, Emily, or someone else, Emily?
No, you, Emily. I
Okay.
think I muted it. I'm sorry. I think that was an operator error. So go ahead.
No worries. Okay, so it's Emily at Hammer again. This might be related to slide 26, but also just a question I had coming into today. So about the announcement with rates being updated to reflect changes. So originally it was that rate. I know that DHS is implementing DWRS changes in February, but nothing that we enter is actually reflecting the 2026 proposed DWRS changes. So if I enter a DWRS service with a January date, it pulls the 2025 data. If I update the start date with a February 2026 date, it still pulls the 2025 data. So at what point is it actually being updated with the new DWRS rates that we should be using?
I'll let Bridget answer that if Bridget wants to come off mute. She says they're still waiting for CMS approval. So it's just
Right.
like my slide shows. So I think what's going to happen, I'll just speak for Bridget, is when the approvals will come through, then you'll see an e-list go out that will give you more instructions.
So there was an e-list that went out on Tuesday that said, yes, we're still waiting on CMS approval, but we're going to have you enter service agreements for February with the 2026 dates because we think that's when it will be approved. So I'm just not really sure how we should be handling February service agreements because with everything else going on at the state level, with payments being slow and things like that, the slower we get service agreements in, the more and more people we're going to have with services suspended.
I think that because it's specifically to DWRS that you should put in a help desk ticket for it and ask that question to them directly. But Bridget, if you want to say more, you can.
Sure. Thanks, Teresa. Hi. So we understand that frustration with, the various e-lists that are going out. But really it's until we have CMS approval, if we try to, create the rate changes and allow for MnCHOICES to calculate the 2026 rate, there's a chance that CMS says that no, it's not going to be effective the date that you requested, which was February 1st. And so it's just a timing issue right now. The release is scheduled for February, so it would be, I think, on February 5th. But that could also change, depending on if we get closer to that date and we still don't hear from them, because ultimately we want to avoid takebacks because we have to have providers billing the rate that CMS has approved with the cost values.
Yeah, so I think maybe the confusion then is the Tuesday e-list said we are proceeding with February rates. If for some reason CMS doesn't approve it, then we will have people do takebacks. But what I'm hearing is there is no way for us to process those February rates. So we should hold all DWRS service agreements.
Correct. Anything after 131 is still going to populate the 2025 rate. And so we just ask you to wait for the next e-list.
Okay, I just want to share that's definitely not what the e-list on Tuesday said, and that's very unclear. So I think a clarification will be needed for case managers.
Yeah, we are in the works of correcting that e-list because we're getting the similar feedback that it wasn't that clear. And so you'll see a new e-list going out hopefully by next Tuesday.
Okay, so we should hold all February DWRS rates until further notice.
Yes, please.
Okay, thank you.
Thank you.
All right, thank you. I'm not seeing any other hands. I do believe I unmuted one person and then there she is. Thanks, Laura. I've unmuted you.
Okay, I wasn't sure if it was a mistake because Emily was still talking. So, just want to be sure. I've been having some reports that are pulled from MnCHOICES with support plans still being open, and we're having trouble closing them. And it's multiple people that are kind of having the same issue. So I didn't know if there was a workaround rather than submitting a help desk for every single support plan. But these support plans have been open this year and also in 2024. They've still been open. And then the issue is that on the support plan signature sheet, every field is completed. But then when you go into the completion requirements, it's showing that it's unfulfilled. Um, so I wasn't sure if there was a current workaround, or if it was because that some of these are older that they haven't received all of the functionality updates. So I just wanted to know. I've been able to kind of work out some of them myself and be able to do the completion requirements, but a lot of the things that I was able to work around were not the same for some of the other support plans. And these support plans are both MCO, MnCHOICES assessments, and just HRA support plans.
Yep, if you want to send that in on the help desk, you can. Usually when we do see that issue, though, it's usually related to the support plan being moved to in progress assessment complete before the assessment was moved to completed status. And if that is the case, they can't be moved forward. You have to create a new support plan. So that's why workflow is super important, and the assessment has to be moved to a completed status before the support plan is moved to in progress assessment complete. So if you think, if you look at the history of the assessment and the support plan, and the dates are pretty clear that no, the assessment actually was completed before the support plan was moved forward, definitely send that in, and we can look at it further. But usually when we see that completion issue in the signature page, it's because the support plan was moved forward before the assessment was completed, and therefore it can't pull in all the assessment information that comes to that signature page, kind of like the CFSS questions. So usually that is the situation where you have to create a new support plan. So, but if you would like, you can certainly send specifics in if you want us to dig a little further.
Okay, yeah, I think part of that, I mean, suggestion, I can look at the workflow history, but a lot of times, I mean, even for myself, the dates that are reflected, the date that I complete or push the support plan is the same date that I finalize the assessment oftentimes. So those dates would often match, but I can double check and submit the help desk ticket for further clarification. I just didn't want to submit a help desk ticket for every single person because there were multiple support plans that needed to be closed. So
yeah, you can put them on the same one, especially if it's like if they're both, you know, MCO or, you know, they'll go to aging, and I can look at them specifically. But I just, most of the time when we see that, it's because of a workflow error. So yeah.
Okay, thank you.
Yep.
Chelsea, it may also be due to a diagnosis. How when you're selecting a diagnosis in the CFSS field or in the CFSS section, if you're adding in the service of CFSS, if you select a diagnosis that you removed that was in the diagnosis health information area and you removed it from, you selected it in the support plan, but you removed it from the health information and didn't update it in the support plan, that's also a really common thing that we're seeing for not being able to close the support plan. It'll tell you something weird about your signature page, but it really is that you just have inconsistent information in your support plan, so check that as well. So it's just something to remember, and sometimes it works just to save and move on, continue through the support plan, and it will, if it's not due to a workflow issue, Just saving multiple times helps as well.
Yeah, because saving updates it, to your point, Beth.
Yep.
All right, thank you. Are there any more questions? I'm not seeing any hands in the queue. So if you have questions, feel free to ask those here.
I'm going to give everyone a pause, see if we have any other questions. Sometimes mentors sit in a room together and talk, or with other assessors and case managers and talk through questions. So we just want to give you a moment. I see 2 hands have been raised.
Yeah. Emily, go ahead.
Hi, it's Emily at Hammer again. So a question that's come up a lot over, I mean, really since we started revision, and I know back in May, I think I personally submitted an enhancement request, but discussion around the signature page and how the printout is not user friendly. There is no actual line that says this is where we would like you to sign. Is there any ETA on that being resolved so that it makes sense for the people we're supporting of where they're supposed to sign, or providers for that matter?
Yeah, they're adding a box this month. We'll have,
Oh, okay.
so
So in next
we're
week's
testing
release?
it. We're
I'll say
testing it
it's
at the moment, but with the next release, you should see some improvement
Okay.
there.
And is that
And
for the individual, the guardian, and waiver providers?
that one is actually just for e-signature. So e-signature will have a line this upcoming release.
Can you clarify what you mean by e-signature will have a line? Like there's already
Yep.
a box if they're signing electronically.
Yes. Yep. So it will, that was part of the feedback, was that when you sign electronically, sometimes people still don't know where to sign. So
Okay.
this upcoming release should be a line. We do also have feedback just about print and how that's also difficult. So it's been submitted as a future enhancement. We can't really speak to release date, but we have definitely received that feedback that the signature is just not user friendly. So that is something that we are working on for the future. But in the upcoming release, there should be at least a line for e-signature. So
Okay.
if they're signing it in person, it'll be a little bit more clear that way.
Okay. If there's any way to just make a note on the print version and like mark it as this has been brought up again, it's just, especially with our folks with physical disabilities, the e-signature is just not an option for quite a few people that we support. And so having the printout not really be functional it's pretty problematic. And I mean, we're quite a ways into using this system, so not having a functional print that looks like a signature page is just, it's becoming ongoingly frustrating, and providers are very confused about where they're supposed to sign, which makes it more difficult for case managers to get those signatures, but they're important, and it just continues to be a concern. So if there's any way to flag that as, can we really try to readdress this soon? I think a lot of people would appreciate that.
Great, thank you.
All right, thanks, Emily. Carrie Johnson, I've unmuted you.
So I had submitted a help desk ticket and I got my reply. It was regarding 65th birthday updates and how they were both done remotely. Why does having them done remotely affect in MMIS the activity type? It should code it as an 08, but it codes it as an 11. So just curious as to why doing it remotely versus in person would affect that activity.
Yeah, so that's how we capture whether the assessment was done in person or remote. So in the assessment it is accurate to display that activity type 11. MMIS is not recognizing that activity type. So when you enter it into MMIS, you would update that to the 08 to reflect it's a 65th birthday assessment.
Because that would be one of the things that, like, it's not going to match. We were talking about matching MMIS to the MnCHOICES, and there really isn't any way to do that.
Yep, it goes back to that data integrity slide that you saw, and what you're hearing them say is, yep, they know they won't match in this instance. So,
Okay, thank you.
yep.
All right, thank you. Next question, Don Pete Jr., I've unmuted you.
Hello, so I was just wondering if there's any guidance, and I might have missed this part, on what case managers should be doing for service agreements which were already entered for 2-1. Should we be denying lines and waiting, or what's the guidance on that?
Are other SMEs available to speak to that?
Yeah, I can speak to that. This is Bridget again. If you've already calculated a rate for 2-1, I would go in and deny that line in MMIS.
Thank you.
Thanks, Bridget. All right, Ashley, you're next.
Hi, I was calling, or I was wondering if there's a timeline for the UMPI numbers to not appear on the support plan. It's very cumbersome and takes extra time for all the administrative staff to go through and remove this information. Plus, that puts us at risk of continuing to share information we're not supposed to.
It has been submitted to our vendor to hide that in print documents, but it has not been implemented yet. So we don't have a specific date that we can speak to, but it has been submitted as something that we need our vendor to update on the print document. So, but I can't speak to a specific date.
So what you hear Chelsea saying is it's in the release schedule. We just don't know when it's been scheduled to occur.
Okay, thank you.
Mm-hmm.
All right, next up is Amanda. Amanda, are you there? Okay, now you are off, or now you are unmuted. I'm not hearing anything, Amanda.
You could be double muted, Amanda, just so you know. Eric, I would say let's go ahead and go to the next one. And then I can see that Carrie's unmuted, and I don't know that she means to, or wants to be. So just so you know.
If I'm not seeing anybody unmuted in my list, so I don't know if Carrie wants to unmute. And I still have Amanda unmuted, but I'm going to try to unmute you, Amanda, and mute you.
Can you hear me now?
Amanda?
Yep, I'm here.
Okay, now we can hear you. Thank you.
Oh, perfect. I'm from Nicollet County. My question back to the UMPI numbers and stuff. Was there a reason that this all of a sudden needs to come off of the support plans? Because those numbers have printed on support plans forever, like back to the original support plans, that was like a PDF even before we had the support plan 1.0, So I just didn't know why all of a sudden they need to come off when they've been on there forever.
So the only thing I think we could say to that is that we became aware that it was considered non-public data. And so therefore the instructions change. How it was done in the past is how it was done in the past. All we know is how it needs to be done now.
All right, I'm not seeing any other questions for us today.
I'll just give us a couple more minutes and then we'll go ahead and close today's call. Just want to make sure somebody doesn't come up with something else they want to make sure they talked about today. I see Lane just raised her hand, Merritt.
Go ahead, Lane.
Hi. So I've noticed every once in a while when I switch between clients I'm working on and I'll like pull down diagnoses and it will be from the previous person I'm working on. So do you guys recommend best practice to refresh between people we're working on?
Can you say
Say
more?
that one more time. Yeah.
So like I'll close out of one and then I'll go into my next person and then I'll be like doing the drop down to put the diagnoses in. And the diagnoses I get are from the previous person I was just working on that pull
Oh,
up. So if I refresh it, it makes it right. But yeah, I've had that happen maybe 2 or 3 times recently.
um, interesting. Thank you for letting us know. We can dig into that a little bit more. And see, but for now, I think your trick of refreshing is wise to refresh between people. But we can dig into that a little bit further and see what we can find out.
I mean, just
Yeah,
making people aware because it would be easy to just pop those.
Right,
You
right,
need
and
to really
especially
make sure you got the right one. So
yeah, and Lane,
right.
I would ask that you actually put it in as a help desk ticket so that we can
sure.
that way we've got a record of it. So if you could do that, that would just be great. But thanks for making people aware.
Yeah, not to policy, to technical, or where do I send it?
Yeah, technical would be just fine and it'll get you
Okay,
where it needs to go.
perfect. Thank you.
You're welcome.
Thank you. Emily, I've unmuted you.
Hi, it's Emily at Hammer again. I just wanted to say that, just to say what Lane was saying as well. So it sounds like that was from an assessment standpoint. We see that in support plan forms as well, anytime there's a drop down. So the one specific area that I see it most often is when we are trying to add a provider into the signature section. The drop down of providers will pull the list of providers from the person I was previously working on. And so I will have to either refresh or completely log out, log back in order to get the current person I'm working on's providers to show up. I can send in just a narrative of it. It's hard to take screenshots because I can't prove on the page that I'm working on that those aren't the right providers, but I can certainly send in a narrative of it. It doesn't happen every single time, but it happens a percentage of the time for sure. So it is happening in support plan forms as well, and it's very specific to the drop-down feature.
Yeah, if you could send that in, Emily, too, just so we are sure to review it in the assessment and the support plan, and then we can kind of look into both of those, because that is very concerning that it's, showing data from a previous person's assessment.
Yeah, and it is intermittent, and so it's difficult to recreate it, which I know makes it difficult from a tech standpoint to address
Sure.
it
No,
as
I see
well.
what you're saying, right? Because you're going
Yeah,
to refresh it and select the correct provider. And so even when we would have to try to recreate and see it here,
right.
it would be.
Yeah, and it's certainly not every time either, but it's definitely happening in a support plan. And from the support plans, it's not about anything from the assessment, it's about other areas of the support plan where it's trying to pull information into a drop down.
Well, and I think what's useful about you sending it in is you will make sure you tell us which drop downs you're seeing it in. So that because, we can listen to you really well, but not get it down right. So
Yeah, that's fine. I'm pretty sure it also is anything from the contacts tab, which sounds like is similar to Lane's experience with the diagnosis information pulling from other areas of the profile. So I will see if I can find some notes from previous consult questions from our staff and send in a ticket about the support plan issues.
Okay, thank you.
Yep.
Yeah, thanks, Emily. Melissa Anderson.
Melissa, I wonder if you're, looks like she's not muted or unmuted.
How about now? Does that work?
Yes, now we can hear you.
Okay, hi. Melissa with Sherburne. With the pending CMS approval where the habilitative component won't be no longer required for DD waiver eligibility, is there any plan for what the MnCHOICES assessment will, any changes that will be made where will those habilitative questions be removed, or will you just kind of like sever the eligibility, like the rules behind eligibility regarding habilitative? Just kind of curious if there's any talk on what that might look like to the assessment.
At this point, I don't think that we're planning any changes to the assessment. It's just allowing support plans to not have that habilitative service. And we don't, we catch that in MMIS, we don't catch it in MnCHOICES. And so it's the work that we're planning to do is more in MMIS.
Okay, thank you.
Yeah, thank you.
All right, any other questions? All right, Teresa, I'm not seeing any. I don't know if you want to hang on for another minute or so.
I'm gonna proceed with the other slides in the slide deck. If another question comes up, we can take it, but I'll assume that we'll close out today's session. So I'll just go ahead and go through my last slides. So as you all are aware, that, or you might not be if you're a new mentor, is the webinar training archive from the Disability Services Division includes office hours, both the PDFs and the recordings. The recordings take a few days to do, up to a week, but then they are posted so you can go back and listen to them as well if you want to. We retain them for 6 months. It's our instructions. Sometimes they're a little bit longer while we wait for house cleaning, but they are available, and the recordings are all YouTube sessions, so they're easy to look at and view, and that make sure they meet accessibility. So today's terms, I always just have a terms list at the end of this to make sure that we all know what we're talking about when we see acronyms and what an e-list is, how to sign up for an e-list, and then the link for partner link in case you haven't used it before and you want to be able to add it to your bookmarks for your browser, and what it is. And then lastly, this is where the e-list archives live. Both for DSD and for our administration. And so you are Aging and Adult Services Division. So you can click on these, add these to your bookmarks as well. And then there's also opportunities to then subscribe to those e-lists if you haven't in the past. And then that's all that I have. So thanks everyone for attending today. We'll go ahead and close this call, and then we will see you in another month. So have a really good rest of your Friday, and thanks very much for today's conversation. I'm going to go ahead and stop sharing, and we will go ahead and end today's call.